Welcome to your journey of understanding and managing chronic obstructive pulmonary disease, or COPD. Whether you've recently been diagnosed, are a caregiver for someone with COPD, or are a healthcare provider, this guide is here to support you in navigating COPD and taking steps toward improving breathing, coping with symptoms, and enhancing quality of life. We know that receiving a diagnosis of COPD can feel overwhelming, but you're not alone. In the next few minutes, we'll explore essential tools, techniques, and resources to help you take control of this journey with confidence. Understanding COPD. COPD is a chronic condition that affects airflow in the lungs, leading to symptoms like shortness of breath, coughing, and mucus production. It includes two main diseases: chronic bronchitis, where the airways become inflamed and produce too much mucus, and emphysema, which damages the air sacs in the lungs, reducing their elasticity and ability to release air. COPD typically develops from long-term exposure to lung irritants, most commonly from smoking, though environmental pollutants and genetic factors can also play a role. Understanding the mechanics of how COPD affects your lungs is essential to managing the condition. This knowledge helps you to recognize symptoms early, reduce triggers, and work with healthcare professionals on a treatment plan tailored to your needs. Breathing techniques and managing exacerbations. Living with COPD means finding ways to breathe easier, even during daily activities. Breathing techniques like pursed lip breathing and diaphragmatic breathing are designed to make each breath more efficient. Let's break them down. Pursed lip breathing. Inhale slowly through your nose, then exhale gently through pursed lips as if blowing out a candle. This technique slows down your breathing, helping you to release trapped air from the lungs and improve oxygen exchange. Diaphragmatic breathing, or belly breathing, focuses on using the diaphragm muscle to breathe deeply, which maximizes airflow and reduces breathlessness. Breathing techniques are especially helpful during a COPD flare-up, or what's known as an exacerbation. Exacerbations are sudden worsening of symptoms like extreme breathlessness, increased mucus, or changes in mucus color. These can be triggered by infections, air pollutants, or even stress. Early recognition of an exacerbation is key. Have an action plan ready that includes medications, contact information for your healthcare team, and steps to take if symptoms worsen. Discuss this plan with your doctor so you're prepared to manage exacerbations quickly and effectively. Stages of COPD and treatment options. COPD progresses through 4 stages: mild, moderate, severe, and very severe, and your treatment plan will often be adjusted based on your stage. In the early stages, symptoms may be mild and easily managed with lifestyle changes and occasional medication. But as COPD advances, symptoms can become more intense, requiring additional treatments. Treatments can include medications like bronchodilators, which help open up the airways, and inhaled corticosteroids to reduce inflammation. These medications are typically taken via inhalers or nebulizers. In more advanced stages, oxygen therapy may become necessary. Oxygen can be delivered through a portable device, allowing you to remain active while maintaining oxygen levels. Pulmonary rehabilitation is another valuable component of treatment. Pulmonary rehab combines education and exercise training designed to improve lung function and physical endurance. This program not only helps you breathe better, but also builds your overall strength, making everyday activities less tiring and boosting quality of life. Lifestyle changes, quitting smoking and exercise. Lifestyle changes play a significant role in managing COPD, with quitting smoking at the top of the list. Smoking is the main cause of COPD, and quitting can slow the disease's progression and improve your response to treatment. You're not alone in this effort. There are support programs, medications, and counseling available to help you quit. The benefits of quitting begin almost immediately and continue to add up over time, reducing your risk of exacerbations and lung infections. Physical activity is another critical lifestyle change. Exercise doesn't have to be strenuous to be effective. Even gentle activities like walking or stretching can strengthen your respiratory muscles, improve your endurance, and help you maintain a healthier weight. Some patients even use harmonicas for respiratory exercises, a fun way to build lung strength while focusing on breath control. Coping with mucus and nutrition tips. One of the challenging symptoms of COPD is managing excess mucus. Mucus production can make breathing more difficult, but there are steps you can take to help manage it. Staying hydrated is crucial, as drinking enough water keeps mucus thinner and easier to clear. Additionally, certain prescribed medications can help reduce mucus buildup or improve mucus clearance. Nutrition also plays a supportive role in COPD management. Eating a balanced diet rich in nutrients helps fuel your body and maintain lung health. Smaller, frequent meals can prevent the feeling of fullness, which can make it harder to breathe. Foods rich in antioxidants, like fruits and vegetables, help reduce inflammation in the lungs. Speak with your healthcare provider about any specific nutritional needs, as some foods may even help minimize mucus production. Understanding pulmonary rehabilitation. Pulmonary rehabilitation, or rehab, is a medically supervised program designed to support COPD patients in strengthening their lungs and improving quality of life. Pulmonary rehab combines physical exercise, education, and breathing techniques tailored to your specific needs. During rehab sessions, you'll learn about lung health, nutrition, managing stress, and how to use medications correctly. Pulmonary rehab has been shown to reduce breathlessness, improve exercise tolerance, and reduce hospitalizations. Ask your healthcare provider if you're a candidate for pulmonary rehab and how to select a program that fits your lifestyle and health goals. Managing COPD as a caregiver. If you're a caregiver for someone with COPD, you play a vital role in managing their condition. Supporting them in taking medications as prescribed, helping with breathing exercises, and recognizing signs of exacerbations are just a few ways you contribute. Additionally, offering emotional support can make a world of difference. COPD can be isolating, and simply being there to listen and encourage can help relieve stress for the person with COPD. Remember that self-care is important for caregivers too. Caring for someone with COPD can be physically and emotionally challenging, so take time for yourself, connect with other caregivers for support, and reach out to healthcare professionals for guidance when needed. For healthcare providers. As a healthcare provider, your knowledge and compassion are instrumental in the lives of COPD patients. Resources such as the COPD Praxis Nexus blog, the 101 library, and professional development courses provide continuing education, research updates, and tools for effective patient management. Staying informed about new treatments, patient education materials, and support services helps ensure that each patient receives the best possible care. Consider utilizing tools like the COPD Pocket Consultant Guide, which aids in tracking patient symptoms, medications, and action plans. This tool can be especially useful for identifying patterns in symptom flare-ups, making it easier to adjust treatment plans as needed. Traveling with COPD and oxygen therapy. Traveling with COPD is absolutely possible with a bit of preparation. If you use oxygen therapy, talk to your healthcare provider about portable oxygen options, which make it easier to stay mobile. When flying, notify the airline in advance to arrange for any oxygen needs during the flight. Additionally, bring copies of your medical records and prescriptions in case of emergencies. Be mindful of environmental factors, like humidity or air quality, which can affect your breathing. Planning ahead ensures you can enjoy your trip while keeping your health as the top priority. And additional resources. Managing COPD involves ongoing education, and there are many resources to support you on this journey. The COPD Patient Education Online Store, e-learning courses, and educational videos provide convenient ways to learn about the condition at your own pace. The COPD Pocket Consultant Guide is a practical tool to help you and your care team monitor your symptoms and track your progress. Also, consider exploring patient stories, support groups, and podcasts to connect with others facing similar challenges. Learning from the experiences of others can provide valuable insights, support, and a sense of community. Closing. Living with COPD may feel overwhelming at times, but remember that by learning more about your condition, practicing breathing techniques, making lifestyle changes, and connecting with supportive resources, you can actively manage your health. Thank you for joining us, and remember, support is just a conversation away. This expanded script provides additional details and context, delivering a comprehensive guide for individuals with COPD, caregivers, and healthcare providers.